This is how to clinically test for SI joint dysfunction. This is the Laslett cluster for sacroiliac joint dysfunction, and it consists of 5 tests meant to differentiate SI joint pain from other causes of low back pain. First test is the SI distraction test, where you position both hands on the inner aspect of the ASIS of the pelvis and apply a simultaneous outward force.
Happy with what he's saying, although I don't use this. It's not very specific, and I think that's the problem I have, is that a lot of our SI joint testing is very general. So for example, they're provocative. So if I do the thing, does it hurt? Yes, no. And if it's a yes, then you have an SI joint problem. But what it doesn't do is it doesn't tell us like what problem is it? And there's different dysfunctions of movement, whether it's an up slip or a down slip, in or out flare, different types of rotations, and those all are real. I know a lot of people criticize the fact that things can't get out of alignment or whatever. That's fine. I'm willing to say that maybe it's not so much out of alignment, but it's not moving very well. And then people criticize, well, it doesn't move very much. That is true, but just because something doesn't move a lot doesn't mean that little bit of movement isn't important. And I think that's really, really important to me in our practice, because the number one thing that we see at Renew that is commonly overlooked by chiropractors and physical therapists is the SI joint. It is commonly stuck, out of alignment, not moving well, not moving the little bit it's supposed to move, whatever you want to call it. That's not happening, and therefore there is pain. And then when I do my techniques, it works really, really well. So I know that that's absolutely the cause of their symptoms. The Laslett cluster is just not very specific to what's wrong, and so I don't tend to use it very much.